Whatever happens, happens. And we'll roll with it.
We got it.
The consummate professional, Dena Ali. Here we go. Corley Moore, Firehouse Vigilance. It is weekly scrap number 158. 158. My guest tonight is Dena Ali. She is a battalion chief with Raleigh, North Carolina Fire Department. Also, prior to that, she served 5 years as a police officer before getting to live the dream that every police officer dreams of in becoming a firefighter. She has a master's undergraduate degree, UNC, where she focused her research on firefighter suicide. She teaches at FDIC. She travels the country. She speaks. Heavily involved in peer support, both founding and supporting it in North Carolina and spreading the word. And she also loves cycling. Dena Ali, it is absolutely my pleasure to have you as the guest of Weekly Scrap number 158. Welcome back.
Awesome. I'm not going to lie and say I'm excited to be here because I'm super nervous. The first one, I got like a lot of really good feedback on, and I think like I'm out of content. But we'll see.
No way. We bumped into each other at Water on the Fire, and we talked for how long? Like an hour and a half straight. So we at least got that going.
Yeah, you're right. And I've got all my books sitting right here.
So if nothing else, we get to start going through the books.
Yeah.
Perfect. Everybody's logging in. Here they come. Absolutely. So Taylor said, so excited for this. Smoothbore Cartel. Thank you, brother. Smoothbore Cartel said, Corley, I will pay you for one of those hats. It's a one of a kind. Hello from Washington comes from Antonio Juan. Versavia Gamanyuk says, hello from South Carolina. I'm sorry if I butchered your name. I always claim no pronunciation savviness. All right, there we go. Pulling up, getting the housekeeping out of the way. Is there anything I missed in the intro? Anything you want to add?
No, I was super impressed because I didn't send you a bio, and I was super impressed that you just was able to send it out.
I actually made most of that up.
It was on point. Like I'm at Andy Frederick's training days, and I brought my mountain bike.
Right on.
And I got a good ride in too. I stopped in Quantico on the way in.
I'm framing you up right now for those who are watching. There we go. Perfect.
Moving my computer probably doesn't help.
Makes it a moving target. All right, here we go. Doing the housekeeping, anything. The Vigilantes. Hype. I always have to hype the Vigilantes. If you're not a part of it and you want to be a part of it, go to firehousevigilance.com. Join us. We read a book or listen to a podcast every month and then get together and talk about it. We talk about all sorts of stuff once a month on what we call the forum. It's a lot of fun. It's a private group. If you want to be a part, go there and join up. This episode today of the Weekly Scrap is brought to you by Key Hose. Check them out on Facebook, The Hose Experts, Elkhart Brass, a Safe Fleet brand, and of course, Affordable Drill Towers, home of the Affordable Drill Tower and the Affordable Standpipe Prop. It is firefighter owned and operated. The only thing you can't do in an Affordable Drill Tower is live fire. Affordable Drill Tower, you can rappel, stretch your hose lines, go through the stairs, go through the floor, do window bailouts, cut holes in the roof props, use the apartment balconies, pump the FDC, flow water from the sprinkler system. Call Steve, 844-55-TOWER, or drop an email to info@affordabledrilltowers.com. And of course, the final one is the scrappiest of the scrappers, my main co-pilot who sits here. You guys can't see this, but this is my laptop. He sits here and he goes through all of your comments and questions, and he cultivates the best ones and throws them up here. And it's one of the reasons the scrap runs so smooth. But Smoothbore Cartel, Kyle Romagus. So there it is. Housekeeping done. We're going to get right into the scrap. Dena, I wanted to lead off with this question, and I was trying to think of how to phrase it. But basically, if someone was struggling, and I don't even know if I want to give any specifics, just struggling, and they tuned into the scrap, what is the go-to place to start in your mind when someone says, man, I just don't know what to do. I don't know where to turn. I'm just kind of struggling. I'm lack of motivation. I don't want to sleep. I don't want to eat. I don't want to work out right. I'm just struck. What is your baseline go-to?
You start off
really soft toss. Really soft toss.
Real nice. Because regional, of course, there's regional differences. And so first and foremost, I think it's really important to establish relationships with people and have meaningful relationships, right? We don't have to have a lot of those. We just have to have a handful. And when I say meaningful relationships, it's basically have somebody in your life that you can open up to and be vulnerable with and admit that you're a total screw up. Be there for them and vice versa. Hopefully they'll allow you to, they'll be there for you when you need something. So I always say, make sure you have that person that you can go to, because a lot of times when you're just really struggling, you just need to connect.
Right.
But so we know, there's the Suicide Prevention Lifeline, and it just changed its number to 988. It's a 3-digit number, which is just easy to remember. It's not a new resource, it's just a change in the number. And the way the Suicide Prevention Lifeline operates is basically it recognizes that people who are in suicidal crisis, their intensity ebbs and flows. So you may peak, and when you peak, be at a point where you could, in fact, kill yourself if you had the means, but that's not a permanent state. With enough time, you'll come back down. So they operate on that understanding, and their goal is to give you a little bit of hope and bring you down, and then help you take the next step. So they help you find local resources, maybe give you some tools. So, of course, if somebody's just really, really struggling and they don't know what to do, they don't know where to turn, 988. That is an awesome resource. You can also text 741-741.
741-741.
And they say if you text badge to 741-741, they'll recognize that you're a first responder and they'll reply appropriately.
Okay.
I've tested it a little bit and it's not 100% on that end, but I believe when anybody is in suicide intensity like that, it doesn't matter what you're first responder or not, the people on the other end are trained to get you through that so that you can have a little hope and you can take the next step.
Nice.
And then lastly, and this might, I'm going to try not to go too deep with this, but this is something I do want to start pushing for. And maybe if we talk about it now, it'll start to get the ball rolling.
Okay. And hey, never be afraid to go deep. It's a scrap. We go as deep as you want to go. So go ahead.
And everybody will start to fall asleep and tune out. They're like, oh, it's so boring. So therapy is so incredibly valuable and helpful. And historically, especially for people in public safety, it was viewed as being for weak people, damaged people, broken people, people who need to talk about their childhood. But therapy could benefit anybody and everybody. Even like you and I, if we're in a good place and we're doing good, seeing a therapist could benefit us because we all have blind spots. We all have areas. Our brains protect us. We have issues even when we're feeling good. And seeing a therapist can kind of help you just see those blind spots and kind of understand them. My favorite thing about therapy is, well, like honestly, the first time I went, you go in with all these fears. You're super vulnerable.
Sure.
You have all these broken pieces, and you're like, man, they are gonna see them. They're gonna point them out, and I'm gonna feel like shit. But the beautiful thing about it is somehow they normalize every one of your flaws. And all of a sudden, like you feel super empowered. You're like, oh, it's completely normal to feel that way.
Right.
I'm not crazy. Or areas where you're hard on yourself, they kind of help you to like be less hard on yourself, to forgive yourself, have grace, to understand being angry is okay. Not wanting to be around toxic people is okay. So I think therapy is just so freaking incredibly important. Honestly, I wish all of our company officers, all of our chiefs would see therapists and then tell people about it. And then that way, people be more likely to see a therapist. So it's really easy to find one. If you go to the website Psychology Today, and if you Google it, sometimes a different website will pop up. So just make sure that you see Psychology Today in the URL. So if you go to that website, the first thing you could do is filter by insurance and location. And then a whole bunch of pictures and bios will pop up.
Okay.
And basically you just look through them, read through them, and see who you connect with. Finding the right clinician is like finding the right pair of running shoes. There's no one size fits all. What's really important isn't if they're experienced with first responders, but if you and them connect. That is the most important piece about it. So every good clinician will tell you, every good educator on it will tell you, make a few phone calls. Most of them allow a 15-minute telephone session, talk to a couple, and then the one that you feel like, man, I like this person.
Right.
Schedule an appointment with that person. So It's a couple things. So meaningful connections, have people in your life. Make sure before you're in crisis, maybe have the conversation like, hey, I watched the scrap. Dena said, I need to pre-plan my crisis. And the first step to that is just having somebody that I know I could reach out to. And, I think you might be that person. Do you mind if, I put you on speed dial if I'm in that position? And I'll do the same for you. So having somebody that you can connect with, of course, 988, if you find yourself just really overwhelmed, call that number. They'll help you come down. They're not going to send law enforcement to your house or any of that mess. And then lastly, if you're struggling, see a therapist. It'll make such a difference. I promise.
No, I love it. I absolutely, and I've never like personally gone to a therapist, but me and my wife did couples, and absolutely saved our marriage. At a certain point of crisis in our relationship, and very open about talking about that.
Yeah, it works. Yeah, I mean, couples counseling is the same as like therapist for like individual. Basically, they just help you identify blind spots, help you identify areas where maybe you're not seeing the full picture, and
Sure.
help you to make better decisions.
Ours gave us basically a safe space to communicate and not feel like you said crazy. Both ways, both ways. I was going to ask, what's the because a lot of people want to know, including myself. I won't claim to know the difference between like a therapist, a counselor, a clinician. Is there anything like that that's specific that you should look for, or does the connection matter more?
That's a good question. So, therapist, counselor, clinician, all interchangeable.
Okay.
But there are different levels. So you have social workers, you have licensed counselors, you have psychologists, and you have psychiatrists. So a social worker, they have a master's degree in social work. They are familiar with a lot of different therapies. They're also familiar with most resources. So basically, if you're just struggling and it's coming from multiple directions, a clinical social worker may be a good person to talk to because they're going to be able to say, "Ooh, I recognize this. This is the direction to go," and they're going to get you in the right direction. Any sort of therapist is just somebody trained in therapy.
Okay.
So the difference between therapy and counseling is like you guys, couples counseling. You go in there, you have a safe place to talk about all your screw ups, all your mistakes, and you learn better ways. So seeing a counselor is just like that. It's a safe place to just open up. And it's so funny. I've heard people tell me that sometimes they see their counselor just to bitch and get it off their chest. Like it's a beautiful place to bitch. But also, like for me, when I finally made an appointment, I made an appointment and I went through counseling, not therapy. The reason for that was the whole time I was depressed and struggling, I was scared. So I never made an appointment. Finally, when I kind of got through, I was involved in peer support. I knew how important it was to see a therapist. So I made an appointment. And at that point, I did not need therapy. So therapy, as opposed to counseling, is basically where they recognize that maybe you are struggling with depression, anxiety, some sort of post-traumatic stress, grief, just an issue. And in therapy, they actually help to resolve that issue. So there's so many different types of modalities of therapy, like cognitive behavioral therapy is the most simple one. With cognitive behavioral therapy, basically they differentiate your thoughts, your feelings, and your behaviors, and help you recognize how a thought can make you feel a certain way, and that feeling can make you behave a certain way. For example, for me, depression was kind of sprung from negative thoughts. And so when I had a thought, say, for example, at work, somebody, said something rude, gave me a look, the immediate thought was, man, I suck. I'm a screw up. And then the feeling was, I don't like myself.
Right.
And then the behavior was depression, isolation. So they stop you at that thought. Why did you think that way? Because of that person. And you recognize that, oh, wait a minute. Like, I don't have to think about myself in a negative way because this person's acting this way. So you change your thoughts, which can change your behaviors, or which can change your feelings and then can change your behaviors. So that's
Right.
one therapy. A therapy for like the gold standard for post-traumatic stress is prolonged exposure therapy. And basically, over 15 sessions, you meet with a clinician, and it can be a psychologist, a therapist, a counselor. it doesn't matter their level as long as they have training in that prolonged exposure therapy. And basically, for those 15 sessions, you guys talk about that trauma. And over the course, you're able to talk about it more, you're able to relax, and you're able to resolve it. It's really fascinating, like learning about that therapy. And basically, they don't know exactly how or why it works, but they think a big piece of it is the relationship with the therapist, and that trust helps you to drop your defenses and move past the trauma.
And
And
you're
then
able to
there's
process.
yeah,
Yeah, okay. No, makes sense. When
yeah,
you make it sound so simple.
it really is. A lot of it
Right.
is like EMDR therapy. That's one that first responders absolutely love. And I think part of it is because you don't have to talk as much in
Right.
EMDR therapy. They basically recreate REM sleep, but when you're awake. And it's simple. It's just it's either like following a finger, things in your hands, and they stimulate this eye movement. So EMDR stands for eye movement desensitization and reprocessing. And in doing that, it's able to separate emotions out of the emotional brain and or events, memories out of that emotional brain and get them into the cognitive part of the brain.
Right. Right on.
So you drop all of the like fight or flight response that comes with it. So EMDR has been really helpful for like post-traumatic stress, depression, anxiety, and a lot of these all, especially addictions. And for us, we struggle a lot with substance use disorders, alcohol, and whatnot. And a lot of these therapies really can help you separate from that. It is important to differentiate between a psychiatrist and a psychologist or a therapist. So, psychiatrist is the only one that is not trained in counseling therapies. They are doctors, they go to medical school, and their job is to do like most doctors, see you for less than 15 minutes, diagnose you, and write you a prescription. You should never see a psychiatrist by like in its on its own.
Okay.
And you should never settle with your general practitioner writing you prescriptions. You need to work in tandem with some sort of therapist. So initially, therapy can be hard. It can cause anxiety. So medication can help with that. Or for some people, they might have chemical imbalances and medications necessary. But if you're just getting medication, all you're doing is just covering up everything. Basically it's the same as drinking alcohol, in my opinion. If that's all you're doing is just taking medication, you're helping yourself relax, you're reducing the anxiety. But the minute you stop taking medication, everything goes back to the way it was.
Right.
Unless you're working in tandem with a therapist and you're actually changing, your relationship with your thoughts, feelings, behaviors, you're changing some of your responses.
No, absolutely. Got the first question coming at you from the audience, if you're ready. Jim
You
Platt.
gave me the hardest one, so ready.
Just an easy soft toss right out the gate. Jim Platt wants to know, Dena, what are some highlights to look for in peers when they are on these ebb and flows of suicidal tendencies?
I like that question. A lot of times after somebody dies by suicide, everybody around them is like, man, what did I miss? What did I miss? And I hate that. And the reason for this, well, it's natural. So I don't hate it because it's wrong. But this is why I hate it based on my knowledge. So for every warning sign, for every risk factor for suicide, there are far more people who exhibit it, exhibit that warning sign, exhibit that risk factor, than die by suicide. So take, for example, substance use. That's a risk factor for suicide. Well, how many people have, abused substances that don't attempt suicide? Right. Depression is another one. How many people have been depressed and have never attempted suicide? So basically, they say even the people that are like the highest risk for suicide, 96% chance that it's a false positive. So if we're just looking for things in people, we're going to find far more false positives. And what we may do is make people shut down. Because think about most first responders. We respond to psychiatric calls. We respond to people who are contemplating suicide, and we see how bad they get treated. And we see how we hear how we talk about them. So for most first responders, we try to do a really good job of hiding that because of, our knowledge. So yes, there are some things to listen out for. For example, if somebody is saying, that they are a burden or that they feel trapped and, life's not worth living. There are those things. But what I recommend far more than looking for risk factors is creating an environment to where when somebody's struggling, they feel safe talking to you.
Proactive.
Yeah, absolutely. And that starts with us being vulnerable. It starts with us admitting, like, man, I've been depressed. If you've had thoughts of suicide, don't hide it. Like, admit it. I went through this time where I had these thoughts, and this is how I got through. Or I heard a story of a fire chief, and I don't think it's even true that he does this. Well, I don't think he sees the counselor every Tuesday, but on his schedule, every Thursday at 2 o'clock, he puts that he's in his therapy appointment. And he does that to kind of destigmatize it.
Right. Send the message.
Yes, I think that's pretty cool.
That is beautiful. Awesome. Steve Miller wants to know, what about for the ones who have trouble talking to therapists because they have never seen the stuff first responders deal with? Does that go back to that connection?
It goes back to that connection. And a lot of first responders get in their own ways. So, they don't know what I deal with, so I'm not going to talk to them. And we do see a lot of bad stuff. And sometimes it's unimaginable and it's really difficult. And it's really difficult to place that upon a clinician or therapist. But who becomes a first responder without anticipating seeing bad things? Like we do this job knowing that we're going to see really bad things and that, we're going to respond to horrendous events. I think sometimes the terrible calls, the traumatic incidents, or saying this therapist doesn't get it is kind of like a scapegoat, a red herring. Because what I've learned from my experiences, from a lot of people that I've talked to, is there's some deep-seated underlying stuff or skills, poor habits that cause more of our problems than the calls we respond to. But I personally, so we've had a lot of clinicians that have reached out to our team who have experience with first responders. And I love it when that happens because we have several that have experience and it's really cool to have them. We've also had these clinicians reach out and tout their experience, and they turned out to be awful because they were narcissistic, they were controlling, they were demanding, and they were hard to connect with. And then we've just met clinicians who were super humble, who just had servant hearts. And through establishing a relationship, they became some of the best ones.
Wow.
So if you're struggling and it's about the job, about the calls, you still have to establish that relationship. A few meetings, connect with that person, and then eventually you'll be able to, get into some of those calls. And the clinician doesn't have to have experience with the calls. They just have to have experience with maybe some of these therapies to help you understand and process your events. Now, I'm not saying that it's better to have one that doesn't have the experience, because if they do have the experience, that's awesome, but you're not always going to get that. So it shouldn't, that shouldn't be your excuse not to try.
No, it's beautiful. No, it's a great answer, man. Chris Logan says, are employers' EAPs even worth using? So there's a lot of people with that mindset towards them. So I want to throw the question at you, see what you think.
So I have been to places where they have worked so well with their EAP that their EAP is probably the best resource out there. The clinicians, when I took one of my first peer support classes, it was in Wisconsin. It was in Madison, Wisconsin. And they have such an incredible relationship with their EAP that the EAP people were in our class learning about peer support. And the first responders knew their EAP providers. It was super strong. At Raleigh, I finally had somebody from our EAP reach out to me and want to, collaborate. And what they eventually did was they took the clinicians that we had vetted and they approved them all as EAP. And they also allowed us, instead of calling EAP and having to get your rotation, they allowed us to let any first responder in Raleigh pick one of the clinicians, and then it was covered. So with that said, if the fire department, the peer support team takes the initiative to work with the EAP, EAPs are incredible. However, most people, and I would say probably 90% of agencies, EAP sucks And the reason it sucks is because all a clinician has to do is check a box for EAP. They're automatically in the rotation. And then you don't know who you're going to get.
Right.
Like we talked about, that connection is so important. So if you get assigned a clinician and there's no connection, or they have no knowledge of first responders, or they are a child psychologist, you're going to be screwed.
Right.
But I've heard people in those areas where it was like that, and they got a great clinician. Also, a lot of the issues that we see aren't the calls. It's a lot of things in personal lives. And financial stress is a big one. Relationships is another one. Parenting, those three things: financial, relationship, and parenting. EAP can connect you to a financial advisor. EAP can connect you to somebody who can help with parenting. EAP can get you with, counseling, marriage counseling. So what we recommend, and what I recommend, like when I teach in North Carolina, is if it is financial, if it's parenting, if it's, your relationship, EAP might be like an amazing first stop.
No, absolutely.
However, if it's you and it's issues that you are dealing with, habits that have taken years to ruin the way you respond to life, like I mean, like so many of us, and I'm not judging, because like basically this is from my experience. Like I allowed some of the things that started when I was 10 to follow me up into my 30s.
Right.
And without correcting them, really caused problems in my 30s. And so when I finally found a clinician, office psychology today, no first responder experience, not through EAP, but literally talked to her on the phone after looking and reading her bio and like getting a big girl crush. Talked to her on the phone. She was awesome. And we were just able to connect, and she was able to just make me feel safe enough to open up about some of those issues that started in my childhood.
Right.
And kind of followed me into adulthood. So if you're struggling and it's just a bunch of crap, and that it's just been building, I think Psychology Today still is the best option, because our insurances are, for most of us, the professional firefighters at least, our insurances cover it and do an exceptional job. Most of us only have to pay like $25 per session.
Beautiful. I had a great one here. What was it? Jason Hacker said, "What about looking in the mirror after a call and thinking one more training rep could have changed the outcome?" So basically guilt, training guilt, I guess it's almost closely related to survivor guilt, but I don't know. Talk to us. What do you think?
Yeah, no, I think, and I'm glad he asked that. Thank you, Jason. That is a moral wound, is what that is. And that leads to grief, which really destroys us. And the reason I'm glad he asked that is because I think more than, oh man, I went on a bad call, my life is over, or I saw this horrible thing, it's ruined me. That's what hurts us, is the moral wounds, knowing that we contributed to it, or maybe our lack of preparation contributed to it. So that's an awesome question. And with that, therapy really, really can be beneficial, because sometimes we can be overly hard on ourselves, right? Like sometimes we are as prepared as we could be, and we still made mistakes. We always make mistakes. But also, I mean, I see it all the time at work. I've experienced it. I know that, just a simple example, my firefighter a couple of years ago burnt his ears in a fire. Not a huge deal. However, in looking at what led to it, there was just a few things. One of them, he didn't drop his ear flaps. And I looked at a bunch of pictures from previous fires, and he never dropped them. And I never pointed out to him. And then also, he's a strong guy. He's tough. So he was used to, carrying that hose line in and not getting low. And that kind of became his default. And so that contributed, because he didn't get low enough. So I walked away from that, even though it was minor, knowing that it was partially my fault for not doing a good job training him, and for not, getting on him previously.
Right.
And that guilt, kind of hurt. But that's something minor. If it was worse, that could have really caused a lot of grief that would have required counseling. There's an amazing book that I think, especially the people tuned in today, and to kind of answer that question, can just really relate to. It's called The Beauty of a Darker Soul. It was written by Joshua Mantz. He was actually an Army officer, and he ended up being shot And the same round that shot him and almost killed him, he coded but survived, killed his highest ranked non-commissioned officer, who they were like partners.
Right.
And he was pulled out of the fight for a few months. And he, as quickly as possible, like got back to work because he just didn't like not being with his men. And he got back to work, and everybody was like, wow, this is resilience. You're amazing. And the next thing he knew, they had him speaking on, post-traumatic growth and resiliency. But all the time, he was really struggling. And a large portion of his struggle, and he says this in the book, he said, getting shot, he was prepared for that. Like, he knew that was going to happen. But what really destroyed him and hurt him was the moral wounds of letting his men down and not being there with them, and losing that non-commissioned officer. And so such a beautiful story, because at the end, in the last chapter, he gave a lot of really good advice. And one of the things is, you just have to give yourself permission to explore your true sources of pain. Oof. And it might be the most microscopic detail that pushes us over. And that's where finding that good clinician, and allowing yourself the opportunity to explore. And what led him to that was literally while he was, speaking nationally about resiliency, he got to a point at 2 a.m. where he was ready to take his life. And luckily, he had somebody that he was able to reach out to. He was able to get connected to a clinician right away. Thank goodness the first clinician was just a good fit. And he kind of describes that experience and how he moved through that. And it's a really good book. And he talks about, it's one of the first books that I read where they talk about moral injuries, moral wounds.
No, I love. Lots of questions coming at you now. You've opened up Pandora's box. So here we go. She's drinking her liquid death. And here we go.
It's good stuff.
It's not a product placement. She loves the stuff. Rob Backer, Art of Reading Smoke, wants to know, Dena, advice for how to best respond to coworkers who express their suicidal ideation or other cry for help, but those being approached aren't formally trained in peer support, so feeling inadequate to deal with it. Just the advice.
So when we teach peer support, we remind the peers that you are no different than you were before you started this class. We're just giving you a few tools. And my goal and my hope is that every single person will somehow at some point in their lives learn these tools, that we can mainstream peer support. Because if you think about the term peer support, it's very simple. It's peers equals supporting each other.
Right.
And, day one, the only thing they learn is confidentiality and active listening. And then day two, they learn a few more things about self-care, about the resources available, the things we talked about earlier with therapies and whatnot. And then this thing called action planning, how to have the conversation to where that person says what they're going to do. So active listening is the most critical piece. It is literally the cornerstone of peer support. And it's something I still suck at. I've been teaching peer support now for 5 years. I'm the worst active listener there is, but I'm working at it all the time.
Every day.
Yeah, active listening is really hard, but it's so incredibly important. It's validating somebody. You don't have to say, I know exactly how you feel. You just validation. Wow, that sounds really hard. I can't imagine what you're going through. I don't know what to say. I'm just so glad that you opened up to me. That validation is huge for people struggling. And then allowing them just a diarrhea of the mouth, ask open-ended questions, allow them to say everything that they want to say. And sometimes, believe it or not, when we teach peer support, one of the big things we teach is don't give advice. And people are like, wait, what do you mean don't give advice? Like, how do I help somebody if I can't give them advice? And there's 3 really important reasons why advice giving is bad. First of all, your advice sucks.
It's true.
Plain and simple, your advice sucks. It's biased. Also, you're more than likely giving advice and solving a symptom rather than the underlying issue. But the most important reason why we don't give advice, besides the fact that it sucks, it's biased, it's solving the symptom, is that as long as you're giving advice, you're disempowering the person.
Right. You're putting yourself in a position over them and telling them.
Yeah.
Okay.
And so for therapists, one of the things they learn is how to give people agency. And basically, and that's like their goal, is to give that person agency. Agency is basically empowering people to make their own decisions. So you want to listen to them. You want to know resources. So you don't have to be trained in peer support to know resources. Anybody here right now today that's listening is learning resources, learning about 988, learning about the website Psychology Today. We all, even if you're not going to find a clinician, go online and play with that. Type in the filters so you know how to use it. Like I've messed with it so much that I can just on the phone with somebody, tell them to, go to the website now, click in your zip code, now go to filters and put in your insurance. So play with that website so you know how to use that. But really and truly, when we teach that 2-day peer support class, we let them know what you need to do now, practice the active listening, and then learn every resource you can possibly learn. Because in the conversation with the person, what you're really going to do is just offer them some resources. I have gone to this therapist that's helped me. Here's, we have this, EAP or whatnot. What do you think? What are you willing to do? And that's the big question to ask the person is, what are you willing to do?
Right.
And my hopes and our hopes are, and I think I'm going to make an appointment. So again, going back to that suicide intensity and how it ebbs and flows. And first and foremost, before I get sued or something, this is not medical advice. This is not legal advice. I'm not a licensed clinician. So don't take anything I say to heart. I don't know how else to, but I hope y'all do. But just don't have me sued or something like that. But so with what I know from suicide intensity and how it ebbs and flows is I know that if I am with that person long enough, they're going to come down. And then when they come down, they can make better decisions. So anybody can be that person for another person. Again, though, it's not being that person for a stranger, somebody that you don't have a relationship with. It's being that person for somebody that you have that relationship with.
Right.
So one of the best things we can do if somebody is in suicide intensity and we don't have training is simply just be there for them. Listen to them. Validate their feelings. Let them know that they're not alone. Sally Spencer Thomas, she is amazing. She has a website. It's called Workplace Suicide Prevention.
Okay.
She teaches a lot about this stuff. And she uses this analogy when you're helping somebody who is suicidal. It's kind of like you're getting in the car with them and they're driving. You know how to get there. You've got the GPS in hand, but you're not taking the steering wheel from them. And you're providing them information. They're making all the decisions. However, you're willingly getting in the car with them and you're staying there with them. And that's kind of like one of the analogies she gives. Just be there with that person. I hope that's helpful.
No, absolutely. All of this is helpful, 100%. We need more conversations about it and more resources, and you're getting the word out there. Joe Fisher wants to know, how do we do a better job as a department and company officers preparing new firefighters for some of the horrors of the profession?
Is it really the horrors of the profession that we need to prepare them for, or is it our health and wellness? So I just got done reading, book 1, Lifetime, Your Body's Clock, your body clock and its essential roles in good health and sleep. And it was so fascinating reading that book, learning how sleep deprivation actually causes more horror than the horrors of the job. And this is also like repeated in this book. His actual title for this book isn't Master Your Mind. It is Fuck Your Feelings. But I got the more appropriate book. But and he again echoes the importance of sleep on everything. But what was really fascinating, like in both of these books in Lifetime, is every single mental health disorder is worsened by sleep deprivation. Every single one. And then there's this bi-directional relationship between inadequate sleep, depression, substance use disorder. And then all of a sudden, you drink alcohol to help you sleep. Alcohol takes away your good sleep, sedates you. So then you wake up, you're fatigued, you have energy drinks. That poor sleep can lead to depression. It can lead to post-traumatic stress disorder. So going back to that initial question, I think instead of preparing people for the horrors of the job, we have to prepare people to take better care of themselves. Instead of, I remember when I was brand new at shift change in the morning, everybody be like, hey, what are you doing today? And some days I was exhausted and I was going to go home and take a nap, but I was afraid to say that because I did not want them to think I was a lazy piece of crap. So I was like, yeah, I'm going to work my side job. I'm going to go be super productive. I have all these things to do. Um, and we still do that. So we need to, first of all, just make sleep important, learn more about the importance of sleep, but also these other things. So in this book, the Ryan Muncie book, he's the author. He's got an audio book and he reads it, and his audio book's pretty cool, but you do have to look up the "Fuck Your Feelings" title. But in that book, he talks about this thing that he calls emotional resilience, and he keeps coming back to it throughout the book. And basically, increasing emotional resilience requires that we increase our bandwidth. And the only way to increase our bandwidth is to improve our heart rate variability, also known as vagal tone, in this really scientific sounding thing called polyvagal theory, which is super complicated. But basically, we have to spend more time in the parasympathetic nervous system. If we want to be more emotionally resilient, we have to spend more time doing activities that take us out of fight or flight. Okay. And we don't realize this, but in today's world, we are actually spending far more time in fight or flight than not. There's a lot of low level activation coming from like notifications on the phone, messaging, Facebook notifications, the poor sleep added to that. So what he recommends is increasing our emotional resiliency by increasing our bandwidth through practicing activities that put us in the parasympathetic nervous system.
So actively trying to stay in the parasympathetic.
Yeah, very simple things. And this was one of my favorite
ones.
Not
a backlash, but yeah. But go ahead, sorry.
No, it's okay. So first of all, he said sleep is the most important. Like, get more sleep, get better sleep, practice good sleep hygiene, try to go to bed at the same time every night. Try to turn off screens before you go to bed. Stop taking substances to help you sleep, because unknowingly those substances are actually not helping you sleep. Sleep is a very active process.
So I want to dig, because I take melatonin. Should I quit taking melatonin?
I'm not a doctor. I cannot offer any medical advice.
When you say substances, do you mean alcohol or pharmaceuticals, sleeping aids?
I don't take melatonin, and I won't take melatonin. And the author of this book, in the book, explained why he won't take melatonin. Okay. So melatonin is like testosterone. There are two things that a lot of firefighters take because they're low on them. And there are two things: melatonin your body produces, testosterone your body produces. When you take it, it signals to the body not to produce it.
Quit making it. Right.
So if you're taking melatonin, you're going to have to depend on it. If you're taking testosterone, you're going to have to depend on it. Melatonin, all melatonin does is help initiate the sleep process. Okay. It doesn't make you sleep deeper or sleep longer. It helps initiate the process. So melatonin is generally recommended when you do a change in time zone, or if you are on night shift and you're trying to sleep during the day when it's more difficult to sleep, maybe take a melatonin, but it's not recommended to take it all the time. So rather than taking melatonin, try to relax before bed. Try to go to bed at the same time. I used to watch Netflix in bed. It was a terrible habit. Now I read before bed, and reading is, for me, super calming. I struggled with sleep. I had a really hard time sleeping. There was a 2-year period where I was really struggling with sleep. And in that time, I took Unisom, I took Benadryl. I got a stuff Dream. I was taking a lot of stuff, and it's taken me years to kind of improve my sleep. And it comes from a lot of habits and practice, trying to go to bed at the same time every night. My phone, I charge it in the bathroom, so it's nowhere close to the bed. I have the book, and I'll read a book before I go to sleep. I use it on my Kindle. There's no blue light on the Kindle, and the Kindle's awesome because I can lay in bed and read, and then as I start to get sleepy, put it to the side. But it was really fascinating. The period of time where my sleep was the worst was actually a period of time where I was working with somebody that was causing me a lot of stress. Okay. And then when that person was transferred and I got another person who caused me zero stress, all of a sudden my sleep drastically improved. And I think it was no coincidence, because anxiety will cause your sleep, will cause you to struggle to sleep. And then struggling to sleep will cause anxiety. So I get it. I know I'm saying sleep more, and there's a lot of people on here who are like, I'm trying. I can't. It's frustrating.
No.
I went through that. Like it took me over an hour to fall asleep, and then I'd wake up at like 3, and I tossed and turned, the alarm went off, and it was so hard. I'm grateful. The last 2.5 years, I've been sleeping really good, and I think it's because of habits and practices. Something a lot of people don't realize is if your room, you do work in it, you have a TV, you have your computer, you're doing active things, your body doesn't associate it with sleep. So it has a harder time sleeping. So try
Nice.
to only sleep in your bedroom. And sex, all the literature recommends that you continue to have sex. It helps sleep. It helps you sleep as well. But
Sex
outside
is
of
approved.
that,
Sex is approved.
sex is
Just
approved.
no Netflix.
No Netflix, no TV,
Okay.
no work. And even they recommend that you don't read fiction, or I'm sorry, nonfiction, things that stimulate the mind more.
Oh, really?
Yeah. Uh,
Okay.
so I thought that was really
No,
fascinating.
I wouldn't have guessed that.
But outside of sleeping, there are other things that will help you go into that sympathetic state. Gratitude. Gratitude is so freaking simple, but it's something none of us do because we think it's cheesy and it doesn't help. But it was just really fascinating for me to read how gratitude is a practice that will switch us into that parasympathetic very quickly. And then also, our brains, the default response is negativity, believe it or not. The brain default to find negative, to find problems. So you have to actively practice looking for the positive.
Okay.
And so going back to a previous question about how do we prepare for all the shit that we see, the trauma, and I bring this up a lot, is you have to practice gratitude every day to offset that. We had a horrendous vehicle accident the other day. I mean, it was literally the worst I've ever seen. And I'm not going to describe all that we saw on that, but it was one of those where before you walked up to the car, you knew that the person was dead based on what you saw on the street.
Sure.
It was really bad, but the worst part of it was there were 2 car seats in the car, and there were toys strewn for like 100 feet or more. So the first crew, they see all that, they know it's a parent, but then also they're wondering if any kids got ejected.
Sure.
But one of the guys, he has 2 young kids, and he gave me a look, and it was one of those looks that I could tell like he wasn't okay, and he was kind of like, trying to let me know that he wasn't okay without saying it. So I pulled him to the side, and I was just like, "Hey, man, are you good?" And he said no, and I mean tears, and he just started struggling. He's got kids at home, and that was
Yeah.
part of it. But one of the bits of advice that I gave him was gratitude. Like, you need to express gratitude. Think of things that you're grateful for, and in doing that, it just kind of it balances that negative so that you're not just obsessed with the negative. In his book, Ryan Munsey, one of the things he recommends is, every day, first thing, what are you grateful for? We're kind of fortunate. It's good and it's bad. Raleigh, North Carolina, we're the South, so we do a lot of Southern Christian habits and
Sure.
behaviors. So we say a blessing before every meal. And I think that's pretty cool. But it's very Christian based, and we have a very diverse organization. I'm Muslim. So that's why sometimes I kind of giggle about it. But one of the recommendations is, before you eat, express gratitude. What are we grateful for today? But it's important not to say the same thing every day. Thank you, God, for this wonderful meal. Look over us and our families. Be like, express gratitude.
Genuine, authentic, or what's the right
genuine,
word?
authentic. Try to come up with something different. Ryan says, don't try to come up with 12 things, just one thing every day. And that's like a biohack to automatically put you in that parasympathetic to let you see the positive and help. Another one of his recommendations for that increasing parasympathetic activity was spending about 75 minutes a week in play. And I love this because when we do fun things or we like don't focus, we feel guilt. And he says, if you feel guilty, you're not like you've lost it. Like, you truly have to spend 75 minutes a day doing things that you enjoy, where your mind isn't looking at the clock, isn't, feeling guilt, but is actually just engaged in that enjoyment. And the recommendation is, what did you do as a kid that you enjoyed?
Right.
More than likely, as an adult, you're still going to enjoy those things. I go mountain biking. Now, granted, sometimes mountain biking isn't play. Sometimes it's work because, you have these apps where it's like, oh, I'm going to beat my time today. But like today, on the way to Andy Frederick's training days, I stopped in Quantico and found a trail. And just went out and rode it. And I swear to God, like I had a smile on my face because I had no idea what was in front of me. And this was a really fun trail. There were like features and whatnot. There were some parts where it hurt because it was some climbing, but I was exploring. I was out in nature, and it was beautiful.
Oh, I
So
love it.
all in all, like we have to just proactively find things that are going to relax us. Practice gratitude, get more sleep. Breathing exercises are so incredibly important and something we don't do. Navy SEALs, they do their box breathing, and it's 4 by 4 by 4 by 4. So you inhale for 4, hold for 4, exhale for 4, hold for 4. And doing that, it drops the respiratory rate to less than 4 a minute. And that activates the hypothalamus, which basically blocks the cortisol release, signals to your body to go into that parasympathetic system. So that's why Navy SEALs do it, because when we're in parasympathetic nervous system as opposed to, you know, fight or flight, our rational brain comes back online and we can make good decisions. We can think. So that also for me, like getting back from a call at night when I'm tossing and turning and can't sleep, trying that breathing exercise. But then take it a step further, a piece I learned recently, when you inhale, that activates fight or flight. When you exhale, that activates parasympathetic. So inhale, your heart rate goes up. Exhale, your heart rate goes down. So a breathing exercise is 4-7-8. So breathe in for 4, hold for 7, exhale for 8. So basically, you're exhaling longer than you're inhaling, and overall, you're increasing that time in the parasympathetic nervous system.
4-7-8. 4-7-8.
4-7-8.
Okay. Okay. I love the talk on sleep, and you say we need better sleep. Now, it doesn't necessarily mean more, or does it mean more? Or I mean, obviously, it depends on how much you're getting. But I'm saying, generally speaking, is more just better, or is it more about the quality and the consistency?
The quality is better, and both of these were echoed. Especially this book, Lifetime. It literally just came out August 29th. Like
Wow.
He wrote it. He's writing it in early 2022. He's a neuroscientist. He's been studying not just sleep but circadian rhythms for years. And he in his book he explained that first of all, like we need to quit saying get 8 hours of sleep. Um, he said sleep is like shoe sizes. It's different for everybody.
Okay.
So some people 7 hours is great. Some people need a little more. But overall, he said the quality is far more important than the quantity. And a lot of people don't realize if you take Ambien or you drink alcohol, those are sedatives. Even sleeping pills like Benadryl and Unisom, they're all sedatives. So they'll knock you out, but they'll also prevent you from having the active process that happens when you sleep. So when you sleep, you go through cycles and stages, and each cycle is 90 minutes. And in each cycle, you'll have 2 stages of sleep. And as the night goes on, and towards the end of it, you're in your REM sleep far more than you're not. So early in the night, you spend a lot more time in the non-rapid eye movement sleep. And that's where toxins are released, memories are consolidated, things like that take place. Towards the end of the night, you spend a lot more time in REM sleep, which is what Dr. Vanderkolk called inbuilt therapy. And so when people don't get REM sleep, those people are more likely to have PTSD because REM actually helps you process traumatic memories, process events, store what you need, get rid of what you don't need. And for a lot of people, what leads to PTSD is having traumatic events stuck in that fight or flight, whereas REM helps to move it through.
Right on.
So you need that quality of sleep. And if you're taking Ambien, you're not going to get that. It's going to sedate you. There will be no REM. It'll be very little of the non-rapid eye movement. So you're not going to be rested. You're not going to be recovered. And they're recently, well, I don't know if it's recent. I think they've known a long time, but they're recently educating us that lack of quality sleep is a key contributor to like dementia and Alzheimer's.
Oh, wow. Wow. No, it's deep. Hugh Long said, Chief, can you discuss shift work being recognized as a carcinogen now?
Yeah, night shift work specifically is recognized by the World Health Organization as a probable carcinogen. They found, they looked especially among nurses, they found much higher rates of cancer in those working the third shift. And in this book, Lifetime, he goes on to talk about the fact that, some people think that they can adapt to night shift and
Sure.
that, I'm a night owl, I'll just alter it. But basically in the book, he disproves that. He says we can't. No matter what you think and say, you cannot adapt to night shift.
So we are built to sleep at night. I mean, is it part of our DNA type deal, or?
It is. It's part of the
Okay.
biology, part of the DNA. Um, and they say, when you're younger, it's easier. And trust me, I've got that experience. When I was in my 20s, when I was a cop, we worked night shift and I was good to go. I could get off at 5 a.m., sleep 4 hours, and be super productive.
Right.
Now, if I don't get 6 hours of sleep, I feel like crap. And the guys I worked with before I got promoted, I shouldn't admit this, but they recognized that like at night, I was kind of a jerk. I didn't want to talk. I didn't want to laugh. Like I didn't
Right.
even want to go on the call. I got on the truck and I was pissed off. Like from the minute I read the notes to the minute we got back. Night shift is hard, but yeah, it's the World Health Organization has classified it as a probable carcinogen. And what they found is just one night of insufficient sleep, this was found in a study, can render 70% of our cancer fighting T cells ineffective.
Wow.
Yeah. So, and that's just one night of insufficient sleep. And over time, when you have a lot of insufficient sleep, that's actually what leads to what they call chronic inflammation. And with chronic inflammation, you have cortisol getting dumped at all times of
Right.
the day. And it impacts all the good that's supposed to be happening with your body. So it leads to metabolic disorders, cardiovascular disorders, but it creates a breeding. So all day, every day, cancer enters our body. That's nothing we do is going to stop cancer from entering our body. However, our body has cancer fighting cells, and when cancer enters the body, it goes and attacks. Insufficient sleep renders them effective. However, chronic inflammation does the opposite, and it actually will help the cancers grow.
Wow.
And they did studies on mice where they injected two groups with tumors. One of the groups of mice got woken up, every hour, so they were unable to get sleep. The other group of mice were able to sleep, and they found the group of mice that were not getting sleep, the tumors grew 200%, whereas the other group of mice, the tumors didn't grow. Wow. And it was just really fascinating, that study, to see how poor sleep kind of creates a breeding ground for cancer to grow.
No, it's fascinating. Hugh Long, same person that asked the last question, wants to know, Chief, as a company officer in chief, do you allow your crews to nap? Do you encourage naps, discourage naps? What's your take on crews napping?
Yes, please nap. I told my guys. So right before I made battalion chief, I'll get made fun of if I say the busiest engine in the city, because if you look at like the last 3 years, Engine 11 was the busiest engine in the city. However, also the last 3 years, we would get beat in the last month by somebody different. So each year we ended up number 2. It was really annoying, but I still call us the busiest engine in the city. I was on a busy engine, and you didn't know, you might sleep all night. You might have a night where you sleep all night, but you didn't know the other night Engine 11 actually got up 5 times. They had a horrible night. So I let my guys know, hey, if you didn't get good sleep last night, if you're tired, please take a nap. And the reason for that is for every hour you're awake, your sleep drive increases. So when we first wake up in the morning, we have very little sleep drive. Adenosine is the compound that creates that sleep drive. As the day goes on, that adenosine builds and our sleep drive builds. So if you come to work fatigued, you're going to just continue to get fatigued, which is absolute common sense. And then at night, if you get a call, so they say if you're up for 18 hours, it's like the equivalent of being a drunk driver in terms of decision making.
Right.
So I always encourage naps. There's 2 types of naps that can benefit you. There's that 20-minute nap that just is like a power nap that gives you a recharge, a refresher. You'll see, like if you lay down for 20 minutes and get up, you just feel good, even though you're like, dang, that wasn't very much.
Right.
Alison Brager, she's a sleep scientist for the Department of Defense. She calls it a tactical nap. She actually teaches with O2X as well. And what she recommends is you drink a little caffeine, you take that 20-minute nap. When you wake up, the caffeine kicks in, and then that 20-minute nap is kicked in.
Gotcha.
Now, that's if you just need some energy to get through the day. If you're on like a busy engine and you may be up all night, or if you're a nurse, a police officer, and you're going to be up all night, the recommendation is to get a 90-minute nap. That's one full cycle of sleep.
Gotcha.
And that will just help delay that adenosine, delay the sleep drive, and make you make better decisions at night and function better at night. So I always encourage naps after lunch. I mean, we feel like crap anyways. Most of us got in the recliner for about 20 minutes. But I told my guys, if they're tired, don't sit in the recliner go to the other side. Please get a nap. We can take care of business later.
Solid. I love it. One of the old, Brian Bastinelli asked this earlier, and I wanted to get to it. This was earlier about incidents and whatnot, so I wanted to throw it in there. But Dena, can you talk about the PCIS? I'm not sure what that is, so I hope you know. Where that fits in the process of getting through an event or events, and how to continue from that point.
I love Brian. Thanks for asking. Thanks for being on, Brian. I think he's still your all-time number one guest, from what I understand.
It was a great scrap. So
yeah, he's amazing. So PCIS is Post-Critical Incident Seminar. We have them in North Carolina, the North Carolina Law Enforcement Assistance Program. They're called NC LEAP. They started off for law enforcement officers, but they've expanded. They help all first responders.
Okay.
And so Brian and I connected a few years back. He let me come teach at his conference, which was really cool. We became friends. I learned about his traumatic brain injury, learned about the incident that caused it. And it was really fascinating because Brian would hint off to me that he wasn't okay. But at that time, I wasn't as receptive as I should have been because I really admired him and I didn't want to like emasculate him. So I didn't respond to the hints he was giving me. And it was really funny because one day he kind of got mad at me for it. He was like, hey, you do the peer support. I'm throwing hints at you and you're not biting. Like, what gives? And I felt awful. So Brian, that was the reason why, by the way, if I never explained that to you, sometimes I don't know if they're giving hints. And you know, I don't know. But so when we finally had the conversation, he called me out. I was able to get him into one of the PCISs in North Carolina. It was just perfect timing. He came down. It was a 3-day seminar. There's experiential therapies, which experiential therapies are another type of therapy we didn't talk about, where it's not just sitting and talking. It's experiences, like where you're engaged. He got to practice a little EMDR. He got to meet some clinicians. The beginning of it is they sit in a triangle and everybody kind of just shares why they're there. And that's really healing. There's a lot of oxytocin that gets released when you connect. How
many people are in the? I mean, when you say seminar, I think big numbers. So that's why I'm wondering.
So it's usually 25. They cap it at 25. Okay. However, you're allowed to bring a spouse, and then
so it's not like 250 people sitting in a trial. Okay, no, that's kind of what I.
There's about 25 peers there as well.
Okay.
Previous attendees, they're there. It's a really cool experience. On Wednesday, they have a steak dinner, keep everybody there. There's a lot of intention in the design of it. And it's a lot of trickery that's involved. You know, some people think they're just coming to a class and then they realize that there's a lot of healing.
Gotcha.
Pretty cool. And it gets the healing process started. So from there, you know, they're exposed to clinicians, they're exposed to EMDR therapy. And then from there, they're able to, you know, connect with a clinician and move forward.
Absolutely. John Spira, Fit to Fight Fire, wants to know, what shift do you feel is the most beneficial for firefighters? I worked a 24 on, 72 off for 5 years and thought that gave us enough recovery over that 72 hours off to come back recovered. What's your thoughts on shift schedules and which one you think, in your unprofessional opinion or whatever, you know,
first of all,
undoctored opinion, whatever I'm trying to say, you know what I'm trying to say.
Do you want you rescuing you? Whenever I hear his name, that's like
absolutely. I love it.
Yeah, so 24/72 is a 43-hour work week. It makes the most sense. It is the only shift schedule that allows appropriate recovery. No other shift schedule allows appropriate recovery. So yes, 24/72. I wish everybody would adopt that. Unfortunately, it's really hard. The Northeast, most departments in the Northeast have that 43-hour work week. So what they found is second to that is the 4896. And the unfortunate thing about the 4896 is most people won't even give it a chance. They're like, absolutely not. Will not be away from my family for 48 hours. But what's fascinating is in all the research on that shift, um, despite the amount of people who didn't want to go to it, if a department tried it, they didn't want to go back. They
Right.
loved it. And so with that 4896, you go into work for 48 hours, which sounds awful. But you do all the business on day one. You go to the grocery store, you get groceries for 2 days, you knock out all your training, you do all the cleaning. And then if you have a super crummy night, a super crummy shift, day two, you've already got groceries, the station's already been cleaned, the truck's already been checked off. Sleep in, take an extra nap, relax. If you had an easy night the night before, you can continue, with your productivity. But if not, there's opportunities to nap there. But when you get off, you have 4 days off every single time, so you have adequate recovery. What the data says is you need a minimum of 24 hours to recover. And so my shift is one on, one off, one on, one off, one off, four off.
Right. That's ours.
Yeah, so that 24 in between isn't adequate for recovery. And I think we all recognize that. And I knew when I was at 11, if we had a super rough night and I came home and had to take a nap, I had a harder time falling asleep that night. So day two, I was a little more fatigued. Always by day three, I was extremely fatigued. So that schedule is one of the worst. It's such a tough conversation because our department has been talking about, switching shift schedules, and we just can't get people to agree on anything. There are
Gotcha.
people who, if we go to 4896, they're like, I'm quitting. So we just stay with what we have, which is that 56-hour work week.
No, and that's all I've known for 25 years. That's it. That's all I know. So, and you're right
Yeah.
about the middle days.
And the frustrating thing is if you look at the science on it, so much science about injuries, about disease, just like Hugh when he asked about cancer, the data says it may cost extra money to switch to that 2472, but long-term savings is going to be substantial because there'll be less accidents, less injuries, less cancers, less PTSD, less disabilities. So you're going to overall save so much money. However, we just can't get the departments to bite on
Right.
that.
It's the belief that that's actually going to be the unseen benefit versus the seen cost.
But also, we're our worst enemy. I talked to one of my coworkers today. So the City of Raleigh Fire Department has a 48-hour rule. You cannot work more than 48 hours. If you do, you will get spoken to. But I talked to one of my coworkers who worked his 24 yesterday. He's working a side gig today. He's going to work 48 hours of overtime at Raleigh, but then he's going to work his other department for 24. So he's really about to work over 100 hours straight. But since it's not at Raleigh, he won't be in trouble.
Right.
Again, we're our worst enemy. If we get that 24/72, Johnson County, next door county to mine, they had that schedule. And there were people that worked full time at two different agencies.
Mm-hmm.
And they were just working every other day, making a ton of money. So again, that's where education, getting back to helping people understand the importance of sleep, what poor sleep does to you, can maybe help them make better decisions. Maybe.
Yeah, it's a big maybe.
Yeah.
Raquel McGrath asks, Chief, how does diet play into all of this? It's a broad question, so go for it.
Yeah, it's a good question. And I'm not an expert. Raquel might be a better expert, but we know that diet does play a role with sleep. And there's so much to it. For example, eating right before bed, not a good idea because it's going to make it harder to fall asleep because your body's going to be doing work. And since I'm not an expert on diet, I'm going to shift the question. I'm sorry, Raquel. But one of the things that I learned is poor sleep screws up your cortisol release. So when we wake up in the morning, the cortisol is at its highest. When we go to bed, it's at its lowest. Cortisol release kind of makes you more active. It kind of is that part of that fight or flight.
Right. Now I was gonna say I've always thought cortisol was all bad. Like, I mean, obviously it has a purpose, in the sympathetic system.
Yes.
But I thought it was just bad in general for us. The stress hormone is what I've always heard of it as.
Yeah, and it becomes dysfunctional, and that's when it gets bad.
Okay.
So with poor sleep, you'll see low cortisol in the morning, high cortisol at night, continuous dumps of cortisol. That's why a lot of police officers have extra weight around the waist. It's not always because they eat donuts. A lot of it has to do with that cortisol release. But again, the cortisol release also impacts our decision making and our cravings. So we
Okay.
crave more sugars, more sweets. So again, that goes back to improving sleep. Improving sleep can get your cortisol release back on track. There are people, if they get their cortisol tested, especially first responders that don't sleep well and spend a lot of time up and on the night shift, they'll find that their cortisol is actually highest at night, which is really dangerous and really bad.
Okay. No, I did not know that. Jamie Wall says, Dena, do you have any experience surveying your crew about their needs for mental health? We have a blanket response of, here's the EAP phone number if you need it, but nothing more personal or directed. Thinking especially of those who tend to shy away from the phone, even when it's not about their mental health.
Yeah, the whole like here's EAP, call it is such garbage, right? It needs to
Yes.
start with the company officer. It needs to start with the crew. We have to have relationships with people. We have to care about people. We have to be able to tell when our people are different, when they're not acting the same. We have to know their families. We have to know events in their lives and be able to know when something's going on. And far more important than EAP is the relationship between the company officer and the individual, if it exists. That relationship can be so meaningful, can provide that individual an opportunity to just open up. And then also, when that trust is built, if it is at a point where somebody needs mental health services, they're going to trust the company officer and they're actually going to call EAP or actually reach out to a clinician. If that trust isn't there, if the relationship isn't strong, if the company officer says, and this is what I hear all the time, you know, this young generation, they're not like us. I don't know nothing about that mental health bullshit, but I hear you young ones need to call it. They're not going to do it because they're like, I don't want to be weak.
Right.
So the company officer can't stigmatize mental health. And more, I was joking with somebody because they brought that up the other day. Well, it wasn't a joke; it was serious. A lot of people in that old generation were alcoholics that beat their wives because that's how they handled the stress. Whereas the young generation, I'm kind of proud of them. Like they speak up when they're not okay. So relationships so freaking important. Destigmatizing help seeking behavior, normalizing these conversations, making it okay not to be okay. If you, as a chief officer, a company officer, if you've gone to therapy, don't be afraid to say, yeah, during this time in my life, I really struggled and had to see a therapist. I still make an appointment twice a year because it just keeps me on track and keeps me healthy. I hope that answered the question. That was a very important question.
No, no, it was. I like the shift. Uh, I like this. Yeah, I'm trying to. There's a lot of questions. We've gone. I don't know when you have to get off and get your sleep, so you have to tell me when to cut it off. Uh, what's the best way to cope with the crit? Yeah, we got that. We got that covered. Do you have any tips? This comes from National Fire Radio. I'm not sure if it's Jeremy or Rob, but National Fire Radio wants to know, Dena, do you have any tips for some good back pocket skills for starting those difficult conversations when they're dealing with stressors from the job or their personal lives? And I mean, you touched on the active listening earlier. Do you have any? What's your go tos? I mean, unless in anything like personal go tos as opposed to the blankets. But go ahead.
Yeah. So I think more importantly than having being able to start that conversation is having the relationship. So
Proactive again.
that, so yeah, having
Yeah.
that relationship so that you can detect when they're off and when when you can ask those questions. And when you can say, hey, Corley, like, you're not yourself. And, normally you're really cheery. Normally, you're on top of things. And I've just noticed the last couple of days, you're different and I'm worried about you. Do you
Right.
want to talk? And I always like to start with the, hey, I've noticed this. I care about you or I'm worried about you. Some statement of like, I give a shit.
Right.
And then do you want to talk? So I'm not like putting you in a corner saying, hey man, you seem really screwed up. Let's go talk. It's, I've noticed this. I care about you. I'm here for you. Do you want to talk? And
Right.
give them the choice. And even in that moment, if they say, no, I really don't want to, a day or two later, after they think on it, or if they get to that point where they really want to talk, they're gonna be like, man, my officer noticed something, or my friend noticed something. They express that they care. Maybe they'll talk and they'll reach out. And I've had that happen before where,
Right.
I may have pointed something out to somebody, or I may have said, hey, I know you're going through a really tough time. I just want you to know if you need anything, I'm here. And, a week, 2 weeks later, I got my phone rang. So
No. Yeah, the message was received and responded to. That's awesome. And it was Rob. He texted and said, "It's me. I just realized I was National Fire Radio right now." Perfect. All right. People are telling me it's past Dina's bedtime. I can't believe she just hasn't logged off. That's from Will Jackson. But so I'll move on. I'll say, okay, book or books that you think firefighters should be reading. I mean, we've talked about a few already, but
So I recently learned that your new favorite book is Ego is the Enemy.
well, it's very high up there.
It was a really good book.
I'm slowly. You turned me on to all of. I can drop his name now as I sit here, but yes, I bought the 3-book set: Ego, Obstacle, and now I'm pulling a complete blank.
Stillness is key.
Stillness, yes.
When you get to that one, you're gonna love it. Stillness is key. So I brought these books to Andy Frederick's training days with me for this very question, FYI. So I had to add.
I love it. That's the preparation right there.
Yeah. So of course, my all-time favorite book on sleep is Matthew Walker's Why We Sleep. And FYI, there's a conference in Las Vegas, Nevada, November 7th and 8th. And Matthew Walker is going to be speaking. Jocko is going to be the keynote. It's going to be awesome. Registration's a little high. It's $5.99, but the hotel rate is $68. It's in Las Vegas, and Jocko is the keynote. Just saying. But Matthew Walker is going to be there. I think that's the first time he's speaking to public safety.
Wow.
Yeah.
Now you're also burying the lead because Dena Ali is also speaking there. Correct?
I heard something about her
yes.
speaking there.
Yes, yeah. Dena Ali is speaking at that one.
Yeah, so
I know you're not going to mention yourself, so I will say Jocko, Matthew Walker, and Dena Ali.
I'm impressed that you know I was going to be there. So Matthew's book, Why We Sleep, is my all-time favorite book about sleep. But like I said, this book, Lifetime by Russell Foster, it just came out. It looks at sleep in a different way. It talks about circadian rhythms, but it further just drives the evidence of how sleep impacts decision-making. He talks about how lack of sleep will amplify the amygdala, which will cause more emotional reactions. He gives really good advice. He says, so, we always say we're first responders, and because of that, we have high divorce rates, and we blame the job. But right. He lays a very good case for why poor sleep leads to high divorce rates. So whereas being a first responder might not be the cause of divorce, being a first responder on shift work that doesn't sleep well could be. And he gives recommendations, and some of the recommendations first of all, when I went to Station 24, which was a really slow station, I had an incredible firefighter come out there as well. And after about the 3rd cycle, we talked about how we didn't want to be there, but then we started to get comfortable there. And he said, man, my kids like me so much more now, because when he was at the busier station, he said he just had a short fuse, and he didn't play with them as much, and he got mad, and then went to that slow station where we were getting more sleep. And it was just so fascinating to hear him say, my kids like me so much more. So in this book, Lifetime, he explains why that's the case, how your amygdala affects your emotions, which give you that short fuse. And some of the advice he gives you is, like, recognize when you're sleep deprived, don't have hard conversations. Because you're going to be more emotional, you're going to have a shorter fuse, and it's going to lead to disagreements. So try not to have those difficult conversations when you are exhausted. Save it for when you're a little more refreshed. The other book, the Ryan Muncie's Fuck Your Feelings, very good book. The entire book talks about that polyvagal theory and how to increase emotional resilience. But also he talks about this concept called move the chains. So for the football fans and people that played football, you get 10 yards for a first down. Am I right?
Yes.
Okay, good.
So far, so good. We're judging you.
Good. You get 10 yards for a first down, and you get 4 chances to get that.
Yes.
So you can either go for the 10 yards every time, where your chances of getting it are slimmer, but you get it in one go, or you can just move the chains. 3.4 each time. So he recommends, with everything in life, just move the chains. Don't go for extreme goals. Don't go for okay, I sleep 3 hours a night, I'm going to start sleeping 8 hours a night. Just move the chains, increase your sleep. We talked about mindfulness, gratitude, move the chains, one practice of gratitude, maybe one practice of mindfulness, just move the chains, take those steps forward. Another book I brought, have you read this one? Think Again by Adam.
It's in my current queue, not to read. I'm on chapter 2. So I've read the intro and chapter 1, and I'm on chapter 2. It's one of the reasons why I'm still reading Ego is the Enemy, because I have like 6 books going at once. But yes, one of my lieutenants actually bought, not mine, a different shift lieutenant bought it for me and gave it to me and said this is a phenomenal book. So yes.
Yeah, it's phenomenal, and it's going to get better as you go. There's a section in here on active listening and
really?
how to have like motivational interviewing. But he talks in detail about this concept I had never heard of called psychological safety. And he talks about NASA. So psychological safety is basically creating an environment at work where people can bring problems up.
Yes.
And not fear, being called a dumbass, where they can actually feel safe to express problems, concerns, speak up. And there's some just really incredible evidence. And, so when you talk about psychological safety, especially in the fire service, they're like, oh, that touchy-feely bull crap. At my EFO class, somebody called it soft batch cookie leadership. Like, really make fun of it. But in this book,
I bet they're a winner to work for too.
Yeah, thank God. Actually, it was John Sparrow. It was your friend Nick that called it soft batch cookie leadership. But in here, the examples he uses, the organizations he uses are NASA, and what they attributed to Columbia and Challenger disasters were a lack of psychological safety. Those were performance cultures where people were afraid of making mistakes, so they hid their mistakes. And that's why a small O-ring caused disaster. So today, NASA has switched from a performance culture to a learning culture. And it was really interesting. The Artemis, was supposed to take off and it kept getting delayed, and now it's delayed longer. So for a lot of people looking at it, they're like, damn, NASA, get your shit together, like what the heck? But I'm watching it with what I know about psychological safety and what I know about NASA. And I know the reason why it's delayed is because they found a problem that may not have even been a problem. However, they're in a learning culture and they're not going to do it until they get it just right, which I think is really cool. And they've empowered people at all levels to speak up and not fear retribution. So anybody can, just say, hey, like, here's a problem or here's a mistake I made. And you see it now, like airline pilots, they've introduced this checkbox in the hospitals. And one of the areas where they studied were like in hospitals. And one of the things they found were the organizations that had more self-report errors were organizations that had the least errors, when it was okay to speak up.
Right.
But so that, like, Adam Grant goes into that and he talks about psychological safety, so many just awesome things. But then in this book, Ryan Munsey's book, he also talks about psychological safety.
Okay.
He explains, and this is what's really fascinating, now it ties together. So we were talking about how you need to be in the parasympathetic nervous system. He recommends psychological safety to keep you in that. So if you are in a work environment and you work for an asshole and you're constantly afraid of making a mistake, you're going to be in fight or flight all day.
Right.
So you're going to have that cortisol release. You're going to have that inflammation. You're not going to feel safe, and you're going to be more likely to have issues ranging from poor sleep, anxiety to PTSD.
Right.
So those two books are really fascinating. So I got really obsessed with, one thing to add, it's not a book, but Adam Grant actually has an episode on his podcast. It's called, When It's Safe to Speak Up at Work? I'll try to pull that and send you the link.
Okay.
But what's so cool about it is the last 11 minutes, General McRaven, he was the SEAL Team 6 leader. He wrote the book, Make Your Bed.
Make Your Bed, yeah.
He talks about psychological safety and how that practice, and it was funny because he was like, I didn't use that term for it, but how that practice is what led to his, SEAL team being the best.
Oh,
He
wow.
he even would in meetings purposely say something off the wall to test if his people would speak up. So he trained them and encouraged them to speak up because he wanted to make sure they spoke up and they felt that they could speak up, which I thought was cool. So with that, I haven't read this book yet. I was really wanting to read it before the scrap, but it looks like I'm glad I didn't because we're already at 10:30.
Yeah.
So Amy Edmondson, she's the one that Adam Grant cites in his book, and she's the one that first discovered psychological safety, looking in the medical environment, looking in NASA. So her book is called The Fearless Organization: Creating Psychological Safety in the Workplace for Learning, Innovation, and Growth. My experiences at work, I really think that we need to delve deeper into that. And, I'm excited about your book because you posted a quote the other day, and basically what you described was
No,
psychological.
you made that comment on there,
Yeah.
psychological safety. I'm just a dumb fireman writing stuff about. Here's the cool part. This is not the same one that was in Florida, because this one is the final, and that's notes. But I've got like 36 changes to make, and it's going to press. So
I'm so excited for that
so
book.
close, so close.
I'm
So
excited.
no, very much so. But you said that quote, psychological safety, and I was like, oh, she completely gets it. I didn't know the term.
That, yeah,
No.
that's the term. And I had a feeling you didn't know it, but what you described was that. And so I think we have a lot of really good fire service leaders, just like General McRaven, who get it. They don't know the
No, absolutely. I
stop
would
that
never.
term,
Right.
but they understand the importance of it, and they're expressing it. So I maybe we need to come up with another term for it so it catches. But I think it's something that we've got to instill in our organizations.
I love it. No, absolutely love it. Love the 4 books. Someone asked if there was there is 2 gentlemen that are working on a document that lists every book ever listed in every episode of the Scrap. It's supposed to be finished next week. And of course, it's never finished because there's always a new episode every week. But they are caught up next week. Currently, you can go to firehousevigilance.com. You can click on the link that's in there that says book list somewhere on that page. You can find it in the menu. And all the way up to episode 50, all the books are listed. As soon as they're done with that document next week, it's Whit Dotson, and I'm sorry I forget the other guy, so don't get mad at me. They have an updated list, and it's going to have every book ever suggested on every Scrap, and according to who suggested it. So anyway, you can find that there. So that's that. Okay, Dena, I'm almost ready to let you go get your precious sleep. But on the Scrap, we do a thing. It's called the 5 questions for firefighters. You were here once before and had to answer the 5 questions, but now it's the next 5 questions for firefighters.
I'm not
so.
prepared.
Don't worry. There are no correct answers. There's just your opinions. And the points are arbitrary, and they're assigned by me. So, Dena, are you ready for the next 5 questions for firefighters?
Oh, I think my signal dropped. No, I'm kidding. Yeah, let's go.
Number 1, what single characteristic makes the difference between a run-of-the-mill firefighter and the top-tier, go-to, badass firefighter?
Wow. And as you asked that, I thought you were going to ask about leadership, and I was going to say trust.
Trust.
Yeah.
Trust.
I think character, just simple character, like who you are behind closed doors and who you are in front of people.
Nice. Consistency, the integrity involved.
All of that.
I like it.
Yeah.
Okay, I like it. Number 2, if you could go back in time and give yourself one piece of advice as a rookie, what would it be?
Relax. Don't take everything so seriously. Enjoy it. Have fun.
Nice.
And it was funny because I was given that advice from like day one, like don't let them see you sweat. And I didn't take it. But now I pass that advice on to people.
Right.
Don't let them see you sweat. Just
are they able to hear it?
No. Like I literally worked with somebody yesterday who reminds me of myself. And he's so hard on himself.
Right.
And I told him, I was like, just smile. Like, don't. And he's like, no, I don't want them to think I'm a piece of crap and talk shit about me. I'm like, who cares what they think about you? Like, screw them. Like, you know who you are. Right. And I could tell he wasn't hearing it because he cares so much. So.
My son, he has about a month left on his probationary year, but about a month left. But he's very, I don't want to say uptight. That's not, he's very, he wants to do well. Very concerned about doing well and being perceived as doing well. So absolutely. I love that. I love that answer. Max points on number 2. Number 3, what is your favorite training drill?
That's a hard one because it's like favorite versus important,
Right. No, that's a great point.
So one that we just started doing more of, and it came from social media, a lot of people on social media doing, but just more mass drills. And I finally, 2 months before making battalion chief, and I shouldn't admit this, but finally learned how to do it with my gloves on. Thank you, Michael Owens, for the tips. He showed me how to use the thumbs to pull.
Yes.
Thank you, Michael.
Which is key if you're going to get your time done with
the gloves. So that was one of my favorite. But then another one that I thought was really important, we did a lot, was simply not the RIT team down firefighter, but you are with somebody and they go down. So without being able to see, being able to confront the air pack, loosen the straps and drag them out. So just doing that and that repetition with it so that when it's completely dark, you can
Make it happen.
make it happen.
I like it. I love it. Number 4, what mistake have you learned the most from in your fire service career?
Man, there's been a lot of them. There's been so many. I think it goes back to like the earlier question about worrying so much.
Mm-hmm.
Like you're going to make mistakes, you're going to have problems. Uh, the kid that I was working with yesterday, the person he cared so much about was not somebody that he should have cared about, because it was the person that he cared so much about was somebody that was subpar, was a bully, wasn't great at his job, but talked a lot of shit. And this
Right.
kid put so much value into that person.
Right.
And I told him, I was like, quit worrying about people like that. Worry about the people that you respect having an issue with you. Don't worry about the hateful people having an issue. Um, so I cared just like he did about everybody, because you think about your reputation. Well, they're going to run their mouth. Who gives a crap?
Right.
But over the years, I made so many mistakes, and with each mistake, I consistently learned. Somebody liked a post of mine from like my first cycle as a battalion chief, and I don't even remember what the mistake was, but I made a mistake that week, and I did not share it, but I remember making a comment about it. The picture you picked for the scrap, there's like a backstory. Did you notice the chlorine on my shirt?
I really didn't. I was just busy
Yeah,
photoshopping and cutting you out of the picture so I could. Yeah.
It's a badass picture. Mo Davis texted it to me. He was like, "Man, badass picture, bro." But that's chlorine on my shirt because I exposed me and my firefighter to chlorine. The guy said it was argon. I went and looked up the ERG for argon, and it said your PPE was good. So we went over there and we were trying to like turn it off. It was a leaking cylinder. We were wearing our gear, so of course I couldn't smell it.
Right? No.
And we couldn't get it, so we came to rehab, and while we're in rehab, the wind shifts, and all of a sudden everybody knows it's not argon because you could smell it. And so on that call that day, I did what I did a lot of my career. I tried to handle the situation before anybody else got there. I was always trying to not use help. I was always trying to take care of it. And that's one of the biggest lessons I learned. And even talking about that call that day is we have a hazmat team. Nobody was in danger. There was no reason for us to try to go there and turn off the tank. I remember thinking, man, if the hazmat team gets here and it's just an argon tank and they have to turn it off, they're going to think we're dumbasses. So I wanted to go solve it. So that was one of the biggest lessons that, constantly reminded is slow down.
Sure.
If everybody's safe, don't put yourself in that environment if you don't have to. And, it's funny, my chief, about 2 years, I had a freaking amazing chief. I sent you that text when I saw the text, the email I sent him. I was so fortunate. I had probably one of the best battalion chiefs in the city of Raleigh. He was my boss for the last 5 years. And so he was also my academy instructor. So he got to see me grow from academy to battalion chief, which was really cool. But about a year and a half into working with him, we had an issue. Back to that person that I said caused me so much stress that I wasn't sleeping. We had an issue, and he came and had to kind of sit down and talk to us. And in the end, he sat down one-on-one with me, and he said, "Dena, I remember you from the academy. You are such a perfectionist that you cannot allow yourself to have any mistakes, and you worry too much about what other people think. And now you're putting that pressure on your crew, and you're being too hard on them. You have to ease up. You have to be okay making mistakes. You have to let your crew make mistakes. Just relax and quit worrying about other people." And I appreciate him saying that, because up until that point, I wasn't too much worried about other people. Yeah, I was. I was worried about, other people being like, "Man, Engine 11, sucks," whatever. But also I was worried about him. I didn't want to make mistakes around him. I didn't want, I wanted to be perfect. And it was just really good to hear it from him. But also that was such an important lesson, because if there was anything that the people that worked for me complained about, first and foremost, sometimes my delivery was a little rough, but it was like I get called like you're intimidating, and you can be hard to please. So it was a good lesson just to relax and allow mistakes. Back to that psychological safety that I'm looking
right on, man. I love it. Max points on number 4. Final question: heavy fire and searchable space. Would you rather be assigned to the nozzle or first in on VES?
I spent all my time on the engine, so I'm sticking with my engine. I mean, yeah, we all want to make a rescue, but who helps people make the rescue? It's the engine. So I'm gonna stick with my engine work and beyond the hose, even though I really want that grab. Vincent Dunn's last book, his memoir, it was a really, really good book.
Okay.
But in there, he talked about, he spent his whole career on an engine, and for that reason, he never got a medal. And engine guys never get medals,
Oh wow.
but they work just as hard.
Mm-hmm.
And I kind of had to think about it. And I'm like, yeah, he's right. Like, yeah, I'm not going to get to make that grab, but we're working just as hard.
No doubt about it. There it is. Number 5, max points. She wants the nozzle. That officially makes the next 5 questions for firefighters according to Dena Ali. And that officially puts 158 scraps in the books from the Dena Ali. If someone wants to get a hold of you, reach out to you, get more information, more books to read, how do they do that?
Facebook, Instagram. If you add me as a friend on Facebook, you have to send me a message because I have a lot of friend requests that are just sitting. I used to like accept them all, and then I didn't know who was who.
Right.
And then I'd
I
see
believe me, I
people
understand that.
like in Pensacola, and they're like, "Hey, we're friends," and I'm like,
I don't know you.
"Hey." So I try now not to add people unless I know them or we have a conversation and there's a reason. Uh, one of my friends just texted me puke face because he's on a ladder.
Beautiful. Beautiful.
Yeah.
So there you go. Socials, Facebook, Instagram. Everybody out there, go to firehousevigilance.com. Join the Vigilantes. Be a part of the private group if you want to join it. We have a lot of fun in there. We are currently listening to man, why am I pulling a blank on names? Seattle, Nozzle Forward. What am I trying to? Aaron Fields. Good Lord. And him on Journeyman's Fireman podcast. And we're going to dissect that episode at the next forum. It's a lot of fun as he talks about how adults learn and teaching. Anyway, if you want to be a part of that, firehousevigilance.com. It's a blast. There you go. Support the scrap. You will get an invite. Yes, so the scraps killer lineup continues. Man, it's been Devin Craig, Mike Dugan, Robbie Townsend, Dena Ali. Next week, Chad Bootsine. It's going to be on Wednesday next week because my mom's birthday is on Monday. So I'm on duty Tuesday, so the scrap will be on Wednesday. And then following Chad, we got Bill Guston, followed by Jay Bonifield. So it's the lineup is just killer and just keeps getting better and better. Phenomenal guest. Please go. If you like the podcast, go and rate it. Not the Facebook page, not the Instagram page, the podcast. Wherever you listen to it, give it 5 stars. Send me a screenshot of the rating, of the review, and you will get bribed with stickers. Firehouse Vigilance stickers like Scrappy and Mutts Don't Scrap. There we go. Boom. Snap into focus. Yeah. So do that. You'll get a sticker pack. I'm bribing people for 5-star ratings. You guys are doing amazing work doing it. Other than that, if you know anybody that wants to sponsor an episode of The Scrap, reach out. There are slots available. They do fill up fast. Just like tonight, we had Key Hose, the hose expert, Elkhart Brass, a safe heat plan, the affordable stand prop, and the affordable drill tower. Absolutely. Key Hose, I like it. I like it. And Smoothbore Cartel. So there you go. My brother Kyle Romagus, as always, he was here pulling your questions out and throwing them in. And finally, Dena Ali, thank you for giving me your evening and staying up late because I know how valuable your sleep is.
Yeah, no, this was a lot of fun. I just got like 10 texts of vomit, by the way. I guess everybody can take a grab. Hey, you mentioned Aaron Fields. This book, something I thought was really funny and not funny, but interesting in the Fuck Your Feelings book was he says comfort is the enemy of growth as well. And that was Aaron's keynote. So
no, that's Aaron's, yeah. Or at least I don't know where it comes from originally, but I definitely learned it from Aaron.
Same.
Yeah.
Cool. Thanks. This was a lot of fun. Thank you.
Oh, every time. I enjoy every one of our conversations. I look forward to seeing you again. Thank you again for your evening. I really do appreciate it. Audience, you guys are the ones that make this so much fun. Your questions are insightful and keep us, they come out with so many different angles. Dena killed it. Thank you, audience. I love you all. Mutts don't scrap. I hope the tones stay silent unless it is burning. Everybody, stay safe out there.